Well, of course. Good morning from the West Coast here, California. I am a rheumatologist, certified in rheumatology for quite a while, and indeed, what we've talked about already is pretty clear that step therapy makes it difficult for all physicians across the board in all disciplines to actually ensure that our patients are getting the therapies that we feel are most appropriate for that individual patient. And indeed, the process of going through step therapy, which is one of just several formulary restrictions, makes the application of that therapy also a delayed process. And as was pointed out just a little bit earlier, delaying therapy in some of these patients can have rather long-lasting consequences. Some perhaps more subtle effects from the physician's standpoint include the fact that this process, and whether it's one of several formulary restrictions, step therapy, prior authorizations, multi-tiered therapies, policies, all of these undermine our relationship with our patients. We work with the patients, they come to seek our opinion, and we try and get them the best therapies we can based upon who the individual patient is. And telling a patient they have a diagnosis and telling them that they need to wait for someone in an insurance company to decide what medicine they can begin is rather frustrating for us. In addition, because these are not the medicines that we perhaps feel are best for our patients, and all medicines have potential side effects, then indeed we also carry the risk of what those side effects will be to our patient on drugs that we did not actually recommend. So there are elements of frustration, and we feel exasperated in trying to get our patients the very best care. In that light, we also try to advocate for our patients, and that means applying for an appeal that we don't agree with the medicines that are being put forth by the insurer. Appeal processes take time. So now we're caught in that endless sort of weeks to months duration of trying to appeal a process. If the appeal is denied, which very often does happen, then indeed you can ask for a peer-to-peer discussion, which once again now puts you out even further in applying treatment for a patient with what can be a rather serious condition. I have a rather small practice, and I have to dedicate my staff to helping me with dealing with these problems. If you have a larger practice, then indeed you might even be in the position that you need to hire additional staff to take care of this. That brings us to the question of how does this impact our office staff? And I mentioned the great frustration for all of us. It's not just doctors and patients, it's the staff. Even pharmacists are frustrated by the great deal of paperwork and procedures that need to be done to comply with some of the insurance policies. Step therapy is just one of several, as I've mentioned. But the staff also, in my case, spends I think we have over 98% of our patients who are covered by commercial payers who indeed have to adhere to some sort of formulary restriction. And that means that my manager, actually, we checked recently, is spending 40 to 50% of her weekly time dealing with authorization requests and then going through the appeal process when we try to advocate for our patients' care. It's a tremendous burden. I have one example I was going to bring up of just showing you how frustrating this can be. Going back to 2012, when United Healthcare came up with a formulary that they decided first-line biologic therapies should be Humira and Enbrel. And this was in the care of rheumatoid arthritis patients. 1 year later, despite the fact that patients on these medicines like Humira might have been doing very well and successful in their therapy, they changed and removed Humira from their list, forcing us then to tell patients who had been on successful therapy that they had to stop and change to something else that was carried by their insurance company. To make matters worse, 2 years later, at the beginning of this year, Humira was added back to the formulary. It was there with other medicines, and they took off Enbrel, which had been on the formulary for 10 years. So patients who had been on 10 years of successful therapy then had to change and go on to something else to comply with their insurer. So this whole rigmarole is very not only unhealthy for patients, but very frustrating and work heavy for our staff in our office.
Dr. Stevens, before we switch to some of the patient groups, we have a question from the audience you mentioned how often, you mentioned the frequency of appeals and how often they're accepted. And the audience wants to know how much time is your staff spending on them, and how often are these appeals accepted by the insurance company when you go through the process?
Well, I don't know that I can give you an exact percentage of what's accepted. Generally, appeals, for the most part, I can tell you are not accepted. The staff spends somewhere between 16 to 20 hours a week working with either the original authorization request or then again dealing with appeal processes.
Yeah, and we've heard from two physicians and how it's affecting the practice of medicine and these rules that insurance companies are putting in place, these failed first or step therapy policies that are preventing it. Now we're going to shift gears a little bit and talk to some of the folks that represent the patients that are affected, and that's